Good afternoon. Welcome to the City of Toronto's COVID-19 media briefing for Monday, July the 6th, 2020. Joining us today is Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory?
Well, Brad, thank you and good afternoon. I'm going to cover a number of things by way of an update this afternoon. This morning, I met with mayors and chairs across Ontario to discuss what our cities need from the federal and provincial governments in response to the COVID-19 pandemic and the impact that it has had on the finances of cities and towns across the province. It was an unprecedented event of concern, of unity and of solidarity from cities and towns right across the province of Ontario. And one thing that is very clear after today's discussion, cities across this province, and for that matter across this country, need help. They need financial help, and they need it fast. As I said earlier today in dealing with this matter with the media, now more than halfway through our financial year, we do not have any more time to waste. The longer you leave the tough decisions when your income is reduced or when your costs go up, the worse the consequences become. And that's exactly where municipalities are, hundreds of them across the province of Ontario represented in our gathering today. Our income has been significantly reduced, some more than others. As you know, in the case of Toronto, the biggest single reduction in income has come from reduced usage of the transit system, $20 million plus per week. Our costs have been significantly increased, looking after people who are homeless and all kinds of different things that are our responsibility, and yet we have very limited ways of making that up. And that inevitably means service cuts, serious service cuts, and the more you postpone making those cuts, if you don't get any assistance, the bigger they have to be in the current year. The COVID-19 pandemic has had devastating impacts on our residents already, and it has devastating impacts as well on our cities and on their finances. In Toronto's case alone, we are facing a roughly $2 billion operating budget deficit, with the single biggest contributor, as I mentioned a moment ago, being the loss of TTC revenue in the hundreds of millions of dollars. Our ability to continue to provide the high quality of services we do, whether it's transit or recreation or childcare or supports for vulnerable people, those services are now being relied on more than ever, and yet our ability to deliver them is threatened if we don't receive support now from the federal and provincial governments. Cities need assurances from the provincial and federal governments that they will support, those other governments, will support our operating shortfalls that were as a result of COVID-19 as well as the increased expenditures. And they have done this in many other instances for many other groups. We need their help to ensure that our cities can recover and rebuild properly without fear of massive unaffordable tax increases or devastating cuts to services. And we are at the very foundation of the successful economic recovery we all need. So along with my colleagues, all of the mayors and regional chairs from across the province, I again call on the federal and provincial governments to come forward and provide necessary and vital funding for our cities that have been on the front lines dealing with the pandemic and supporting people throughout. I want to respectfully suggest that they could set a deadline, and they should set a deadline on themselves, of this week, even if it is just the Ontario and federal governments which can reach a deal between the two of them. I have conveyed this sentiment to senior officials in both the Government of Ontario and the Government of Canada, because I believe that a Canada-Ontario agreement could move things forward. And I know that both Prime Minister Trudeau and Premier Ford, who's been very helpful in providing leadership in trying to bring the provinces together, understand completely the importance of stable, strong cities in bringing about the kind of recovery we need from this pandemic. Over the past few weeks, we've been working hard across city divisions to open up Toronto as quickly as possible, but also at the same time as safely as possible. We've made efforts to open many outdoor recreational amenities, including community and allotment gardens, golf courses, tennis courts, outdoor pools, splash pools, and wading pools. Things are opening up in our city, and we want to continue to move forward with care, but move forward nonetheless. I know many people are eager to get outside and to enjoy the warm weather and to stay active after months of being cooped up. So I'm pleased to announce that we will be opening the city's sport and multi-use fields, albeit with restrictions and limited capacity, for the remainder of the summer season. The city offers close to 700 sports fields at more than 170 locations across Toronto. All 170 outdoor sport and multi-use field locations will be opened by tomorrow and will remain open with limited capacity and some restrictions for training for sports such as soccer, softball, lacrosse, baseball, and cricket. Permits for outdoor sports facilities, multi-use fields, and other outdoor locations will also resume this week. This includes sports training for individual athletes and sports groups or teams with no games or matches allowed, small group outdoor fitness programs, including boot camps and yoga classes and the like, small group social gatherings such as picnics and small parties, summer camps operated by outside agencies in accordance with the provincial camps guidelines, and commercial photography and ceremonial events. The opening of these fields under these conditions will meet both health recommendations and provincial directions and restrictions on gatherings. The guidelines for the city's outdoor sport and multi-use fields are similar for other outdoor activities with some additional precautions, such as continuing to practice sound physical distancing, practicing good hand hygiene and respiratory etiquette, and considering wearing a mask or face covering when physical distancing is not possible. And that's all in order to keep transmission of this virus, COVID-19, as low as it possibly can be. Permit holders must also maintain an attendance record to help with contact tracing if required. Additional precautions and restrictions include significantly reduced capacity so that only 10 people will be permitted per field at any time. And this includes both participants and coaches, as well as parents and guardians, with no additional spectators permitted. At this time, scrimmages and games are not permitted, even in the course of training or amongst teammates, and there will be physical distancing requirements. While the fields are open, the pavilions, the clubhouses, the change areas, and the lockers will not be available for use under existing provincial orders. Players should use individual equipment, and leagues should ensure that any provided equipment is cleaned between uses. Now, I know for many people it will be disappointing that we're not getting back into allowing sports full swing, but just the steps we are taking is a step forward, but at the same time, these are steps necessary to stop the spread of COVID-19 and avoid the kind of resurgence that we are all trying to avoid. With the lower virus transmission rates associated with outdoor activities, the safe and careful operational plans we have put in place that I've been describing to you in summary today will work well with our continued diligence as Torontonians to follow the public health guidelines put in place so that we can all enjoy these outdoor activities safely. I want to thank our staff, our city staff, and our public health staff for their continued hard work in reopening vital city services and developing these guidelines and qualifications so that we can all remain safe. It takes efforts from multiple city divisions to get these things done. Also today, the provincial government announced new legislation aimed at accelerating the construction of transit stations. This follows on the agreement we reached last year, which will see the province provide $30 billion worth of new and much-needed transit in the City of Toronto, subject to some partnership activities on our own part. We've been working closely with the province since that time to ensure that the city's interests continue to be represented, and we will continue to do so as their planning and design efforts for these stations gets underway. Our agreement is clear, and I heard the ministers repeat again today that while they will build these stations, it will be done in full consultation with the City of Toronto and with local communities. We are partners in building this transit, and I look forward to the ongoing consultation with the province to ensure that, yes, we build the transit quickly, but that we do it right for the neighborhoods where the stations will be located, including a focus on affordable housing across the city. I'm as committed as ever to getting on with building transit in the city because we need it so badly. Before I finish, I want to remind residents that starting today, the city's 50 automated speed enforcement cameras will start ticketing drivers who are caught traveling in excess of the posted speed limit. Signage is installed at all 50 automated speed enforcement locations so that motorists are aware of their presence there, and it has changed now to reflect the fact that the cameras are now in use in ticketing, so the signs all now say that. The 50 cameras currently installed will ticket speeding vehicles from today until mid-October, when they may be rotated to new locations. The resumption of this service is not only necessary, but will hopefully help us make our roads much safer and save lives as part of the Vision Zero initiative. speeding continues to be a preventable issue that is causing serious injuries, fatalities, and immense emotional suffering, and it simply must stop. I am confident that this program will curb excessive speeding and improve the lives of our most vulnerable road users who are often the victims of irresponsible and reckless driving. I'd like to remind everyone that lives are at stake here. No loss of life as a result of a traffic collision is acceptable, and proactively addressing road safety continues to be a top priority of mine and of the City of Toronto. I thank all residents who do the right thing every day and obey the rules of the road, whether they're driving a car, riding a bike, or walking. I want to thank them for that. I want to urge them to continue to do so. I now pass on the microphone to Dr. de Villa, who will provide a further update on our city's public health situation for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 67 new COVID-19 infections in Toronto. To date, 12,844 people have recovered, an increase of 71 since yesterday. As always, for more detailed data on the status of COVID-19 cases in our city, I encourage you to visit our website. As mentioned during my last update, starting today, we are now moving to a new data reporting schedule that aligns with our COVID monitoring dashboard cycle, and we will be updating our COVID-19 case numbers on Mondays, Wednesdays, and Fridays. While there is some fluctuation occurring in our daily data, at this point in the outbreak, it is more valuable to focus on the general trends and patterns. Our new reporting schedule will allow our data team to dig deeper into these trends to better inform our actions to further reduce virus spread in our city. If our local situation changes, we will certainly go back to the daily reporting frequency. In keeping with our goal to help you stay informed, I am pleased to share that this week my team will be publishing individual-level, non-identifiable COVID-19 case data on age range, gender, hospitalization, and the date of an individual's illness and neighborhood. This information, which will be published on the city's open data public platform, will help demonstrate how this virus has impacted our city. As of today, our COVID-19 monitoring dashboard shows that our overall status continues to be yellow, with 3 of 4 categories of indicators showing a yellow status and 1 showing a green status. Of note from the dashboard, our 7-day moving average for new cases and the number of new outbreaks showed small increases last week, which changed the overall virus spread and containment category to a yellow status on Friday. The dashboard otherwise remains stable. We are still in the middle of a pandemic, and it is to be expected that as the city opens up and more people interact in the community, that we will see changes and fluctuations in our dashboard indicators. The key is to monitor these indicators and to be quick to act when and if our indicators tell us that our situation is no longer improving. As you know, last week, Toronto City Council voted unanimously in favor of requiring that masks or face coverings be worn in all enclosed public spaces. This action, which will help us to better protect each other, will take effect tomorrow. This means that wearing a mask or face covering will be required in all indoor public spaces, such as convenience stores, malls, grocery stores, bakeries, farmers markets, businesses, and offices, just to name a few. These are businesses and offices that are open to the public. You are not required to wear masks at home, while eating on an outdoor restaurant patio, and this bylaw also does not apply to childcare centers. I think it's also important to note that it is understood that not everyone can wear a mask. If someone is suffering from a medical condition that makes it difficult to breathe or function while wearing a mask, they should not wear one. Children under the age of 2 also do not have to wear a mask. A complete list of settings that this bylaw applies to is available on our website. But at this time, I would ask that when heading out of your home, I encourage you to make sure that you bring a mask with you. Over the weekend, I was very pleased to see most people wearing masks while they were out and about running errands in our city. I am also very encouraged to see that many people are taking this public health action seriously, as demonstrated by the more than 10,000 visits made to the mask bylaw website just last week. So for this, I thank you. Finally, with this very warm weather upon us, many residents have been enjoying our parks, our beaches, our pools, and our splash pads. These are great places for us to go and cool down during hot weather. However, it is important for us to work together to avoid overcrowding. COVID-19 is still circulating in our community, and we are still living through a pandemic. So please, be mindful of keeping 6 feet distance with everyone who is not part of your social circle. I would ask that you please keep your mask on hand for those situations where you cannot maintain that distance. These actions will help us to keep reducing virus spread in our city. We do not want to set ourselves back and see a surge in new infections, as has been the case in some parts of the United States. The reality is that we must continue to be vigilant in our efforts to reduce the spread of COVID-19 in our city. I know that everyone wants to get back to life as it was before COVID-19. However, this is our new normal until we have treatments or a vaccine available. Please keep doing your part, and please support each other to help keep our city moving forward. The hot temperatures are expected to continue in our city this week, so please remember to drink plenty of water to stay hydrated, and call or text family members and friends to check on others who live alone. Please also continue to keep your distance from others outside of your social circle. Keep washing your hands and wearing your mask where a 6-foot distance cannot be maintained. Please, I ask that you do everything you can to continue taking care of each other. With that, I'll turn it over to Brad.
Thank you, Dr. de Villa. We have several staff on the line, should any of you have questions, including Mary Ann Bedard from Shelter Support and Housing, Carlton Grant from Municipal Licensing and Standards, Janie Roma from Parks, Forestry and Recreation, Paul Raftis from Senior Services and Long-Term Care, and Barbara Gray from Transportation Services. First question is to Faiza Amin from City News. Faiza, go ahead, please.
Hi, good afternoon. I wanted to ask about the scheduling change with COVID-19 updates. There's been some concerns expressed online, including from scientists, that fewer updates will lead to a lack of transparency and false assurances. How do you respond to these concerns?
So I think it's important that, we have strongly believed all the way through the COVID-19 response that it was important that we put data out there and that we maintain that transparency and accountability. And this is exactly what we've done from the beginning. So we've continued to provide data, and at this stage, we know that what makes more sense to follow are the general trends in the data rather than monitoring the day-to-day fluctuations. This doesn't mean that we're not going to be reporting our data to the province on a daily basis. That will continue to happen in the system. However, what we're looking for is ensuring that our data team actually has that time to provide those deeper dives into the data that we have so that we can prepare for future activity and in particular a potential second wave. And I think also in the spirit of transparency and accountability to our public, we are putting more and more of our data up, available for public use through the open data platform. And that takes time as well. So I think when we look at it all together, we're continuing to do our very, very best to make sure that our public stays informed with the information that actually makes a difference to them and to the circumstance here in our city.
Thank you. My follow-up is we've been learning more about the collection of the disaggregated data that's been collected, and some of that points to some disparities already. So at what point does the city think it'll have a bigger picture of how communities are being impacted? And can you talk a little bit about the steps public health will be taking to tackle or address these disparities?
So I think disparities in health speaks to the social determinants of health, and that's an issue that has been of concern to public health long before there was a COVID-19. And I think what's also important to note is that when we talk about those social determinants of health, that while public health certainly plays a role, particularly on the data side, actually addressing the social determinants of health will be something that requires the involvement and the actions of a multitude of sectors. Everything from social security and income security to housing to childcare to education. It's a multifaceted issue. These are multifaceted challenges that are before us, and certainly not exclusively within the control or purview of public health. So at this point in time, when we're looking at the data that we've been assembling, that disaggregated data that you were speaking of, we're hoping that we should have a report available towards the end of the month, a fulsome report towards the end of the month. And our plan is to certainly act on those components that are within our control as public health to move forward on, but certainly to share the data with other partners so that together we might have that opportunity to really make progress on the social determinants of health. Again, those are determinants that require the involvement of a multitude of sectors, not exclusively public health or health care for that matter.
Okay, thank you. We go next to Lauren Pelly from CBC News. Go ahead, Lauren.
Question again for Dr. de Villa. The province is sort of hinting that stage 3 is coming fairly quickly. They're hoping to move to that as soon as possible. Not sure if Toronto would be included in that right away, but you know, as we move towards that, what is your advice for people to navigate risk now that more and more businesses could be reopening soon?
So thanks for that question, and it's an important one. But I would suggest that what people need to do and what I would advise people to do continues to be fairly consistent. We know that physical distancing makes a difference. So to the extent that people are able to practice that physical distancing, to save and exclude for their social circle, that is one of the most powerful measures that's out there. That combined with hand washing, staying home when you're sick, avoiding wherever possible touching your face, and where that physical distance cannot be maintained, use of a cloth mask or a face covering. And remember that this is the action that we can take together as a community to protect each other. I wear my mask to protect you, you wear your mask to protect me. These are the core fundamental actions that people can take to protect themselves and to best protect our community and to help us keep moving forward towards the next stages of recovery in our city. I know we all want to return to some form of life similar to what we had before COVID-19, and it will take that concerted effort on all of our parts in order to move in that direction.
Just wondering if you have any thoughts as well on, you know, as the province reopens in different areas, more people are starting to travel to smaller towns, little resort towns and things like that. And I know that officials in some of those areas have concerns about people coming from the GTA where there's more cases to those areas. Is there anything else specifically people here should keep in mind as they start doing road trips and traveling more around the province?
Well, I think that, you're right. There have certainly been some requests from other jurisdictions around limiting movement and restricting travel. But I think fundamentally what is most important and what best protects communities, whether it's our own or communities that are further away from us around the province, it really does come down to those core public health measures. I can't emphasize that enough. We know that there is extremely strong evidence in respect of physical distancing, hand washing, staying home when you're sick, avoiding touching your face, and using a mask or a face covering to best protect our community, those around us, and each other. I think these are the fundamental actions, and really we cannot keep saying them enough. So the more we all do that together, whether you're in Toronto or in more remote parts of the province, this is what will actually move us all together forwards.
Okay, thank you. We go next to Ashley Legasic from News Talk 1010. Ashley?
Hi, everyone. Mayor Tory, I'm curious as to how the reopenings of outdoor swimming pools has gone so far, especially with this heat wave. A lot of people are trying to cool off. Have pools been busy? Have people been abiding by the new regulations? And what does a typical visit to an outdoor pool look like right now? What are the differences in regulations?
Well, I'll just speak to the differences, which principally consist of a requirement to identify yourself and provide contact information when you arrive. The period of time you can stay in the pool is limited to 45 minutes. The number of bathers in the pool at a time is limited, and there's 15 minutes set aside out of every hour, in addition to the 45 minutes of bathing time that is set aside to clean the pool area each time. And so these are significant differences that reduce the capacity of the pools in hot weather or otherwise. But I'll ask Janie Romoff to comment on how things have been going. I will just say this about this past weekend. There were some exceptions here and there, but I was watching the media carefully, and Janie and I had had some discussions about, what could be done in the event that things, deteriorated with respect to the beaches in particular. And I would just say that I really have noticed, whether it's masks, face coverings, whether it's social distancing, whether it's people being willing to go along with the different rules and qualifications that are in place at pools and beaches and otherwise, that I think people are really getting it, and there's always a few who don't, but I was very gratified by the fact that things I think have been better this weekend. Not perfect, but better, and I think that's a good sign of things to come in terms of people, following along with the guidelines and rules and helping to prevent the spread of the virus. Janie, would you like to comment on any particular experiences we've had?
Janie, you there? You're unmuted on this end, Janie.
Oh, I'm here.
Okay,
Sorry.
thank you. Go ahead.
Thanks, Mayor Tory. Yeah, the response this weekend was quite overwhelming. We were really happy we were able to open all the outdoor pools, the splash pads, and the wading pools, especially with the heat wave. People have, for the most part, when it comes to the outdoor pools, been following all the rules and all the regulations, have been participating very, very responsibly. I should say that there have been some lineups outside of, some of our more popular outdoor pools, and we're monitoring those lineups and trying to keep the website as up to date as possible with information around where people can go and some options for folks. But the response has been quite positive and has rolled out quite well.
Thanks, Janie. Ashley, do you have a follow-up?
I do, yes. Thank you both so much. My next question, perhaps Mayor Tory, yourself, and Dr. de Villa will be able to speak to, and it's also related to what Lauren asked a little bit earlier. If numbers continue going the way that they are, we will likely be able to head into stage 3 before the end of the month. Will the city be prepared for that if that were to happen at that time? And what would stage 3 look like in the city of Toronto?
Well, I think stage 3 would lead to the point where many things, the remaining things that are not open, whether it be recreational facilities, gym, fitness clubs, and that kind of thing, as well, of course, as indoor dining would be opened either in whole or in part. And I can just tell you that I'm really gratified at the work that continues to be done under the leadership of Saad Rafi and Dr. Mowat in preparing, as we speak, guidelines and all kinds of detailed material so that the people directly affected by that will be in a position to know what the requirements are going to be or to know what they can do to keep people safe once we get to that stage. I'm also gratified from my conversations over the weekend with senior government officials to know that they will be listening very carefully to the advice and the views of our medical officer of health and Dr. Mowat with respect to the Toronto situation, such that if the numbers suggest we should be treated differently than some other parts of the province, they will still be willing and prepared to take that into account. And I think that's fair and appropriate. I think it worked well for us before in terms of our own numbers being looked at separate and apart from others. And we can all keep our fingers crossed that that day of stage 3 and whatever it brings in terms of the reopening of most other things will come as soon as possible.
Okay, thank you. We go next to Richard Warnica from the National Post. Richard, go ahead, please.
Hi. The city Twitter account sent out a tweet this weekend re-emphasizing that drinking in parks and beaches is still against the rules and still will be ticketed. I'm wondering, given everything that we know now about transmission in indoor spaces versus outdoor spaces, why there isn't more leniency on this, and whether the city is worried at all about pushing people who are going to drink anyway into indoor spaces.
So perhaps I can start off with that. So you're quite right. I think as we have learned over the course of this outbreak, we know that the risk of transmission is certainly lower within the context of outdoor settings relative to indoor settings. I think that, we should be looking at, what best we can do to mitigate risk and to create circumstances that allow for our population to be as successful as possible. I can tell you that at the recent virtual meeting of the Board of Health, we talked about deploying behavioral science knowledge to help create the circumstances that allow for people to engage in the right behaviors. And we recognize that there is going to be some desire, quite naturally, on the part of our citizens to want to, socialize and to engage in, those kinds of behaviors that normally would have taken place in indoor settings. So I can assure you that those conversations are happening. I don't have direct purview over every aspect of that which is under the city's purview, but certainly we're having those conversations, trying to understand what we can do to create circumstances. And you've seen that we're already doing that, whether that's through active TO or cafe TO. We're trying to create those circumstances that allow for people to enjoy the city in as safe a way as possible, recognizing that we are coexisting with COVID-19 circulating in our community. I don't know, Mr. Mayor, whether there's anything further you wish to add on that.
I'll just add this. I don't think anybody expects that we're going to be only conducting Bible study groups, not that there's anything wrong with that in our public parks and so on, but I will point out that we only had a total of 85 complaints over the course of the weekend about parks and gatherings, whereas those numbers earlier on in the spring were in the hundreds over the course of any day on the weekend. And so I think people are getting the message, and as usual, it's a message that sort of says, let's do things in moderation. I think the fact that there are more patios and places like that that are now open have taken some of the pressure off people having to be in parks or on beaches. But I think that the number who are doing things that are irresponsible when it comes to the consumption of alcohol is relatively small. We still have to focus on that as we're doing. And that's what we will continue to do. There were, hundreds of educational encounters as between bylaw and police officers and the public over the weekend, but it's been reported back to us that most of the time when those take place, people are compliant. When they're told you can't bring that quantity of alcohol to a beach or to a park, please take it back to where it came from, to the car or home. People do that, and those that aren't, relatively few in number, are ticketed.
So I'll just follow up, Mayor Tory. If what we're seeing is more people get that you have to act responsibly, and throughout this entire situation, we've said, okay, let's trust the people to do things in a responsible manner. Why not just trust the people of this city to have a beer in a park in a responsible manner when, maybe they don't have a yard, maybe they don't have somewhere they can actually see a friend and have a glass of wine or a beer? Why not just say we're going to have some easing here, don't go over the top, but if you want to have a beer, have a beer?
You've heard me say many times before the pandemic that I would be quite willing to look at reviewing some of our rules in that regard to provide for just that. And there's always people who are going to abuse that, whatever the rules might be. But I think people are responsible enough And I think in some respects, if you have that kind of limited latitude, you may even prevent some of the situations that I've seen with my own eyes where people are carrying multiple cases of beer into a park, which clearly is not moderation. It is clearly not behavior that's going to lead to, to a good outcome, and it is clearly flagrantly against the rules. And so let's take it one day at a time in the course of this pandemic. I think now people are getting the message, and the bylaw and police people are helping to say to those who would engage in excessive consumption of alcohol in these public places that that's not on. But if you said, is it possible we could take a look at some of those rules later to accept the reality of what's actually happening and to accept the fact that most people behave, quite responsibly in that regard? That's something I've said many times that I'd be willing to do in conjunction with the province, because it's a kind of a mixed, regulatory environment in that regard.
Okay, thank you. We go next to Brian Passafume from the Toronto Sun. Go ahead, Brian.
Good afternoon. First question's for the mayor. I know it's only the first day of the speed camera enforcement in the city, but have you heard any feedback or advice on how things are going, either from today or the days leading up to when the real tickets started being mailed out?
The only feedback I heard were from some city officials who went out to check out a couple of the locations where the cameras went live today, even though they'd been there and recording information for some time, and they said the traffic was considerably slowed down because the signs, of course, now say that the cameras are active and tickets will be issued. And so you have to hope that's the result. I've said many times before that if we made the investment in these cameras, picked the locations very carefully all around schools and other community points of sensitivity, and there are no tickets issued because nobody is speeding, I'll be the happiest guy in town. I'll just make arrangements to sell those cameras to somebody else if we can solve what was really, I think, an epidemic of speeding that was costing many lives and many injuries and a lot of unsafe circumstances for pedestrians and cyclists and for other motorists.
Okay. Secondly, staying on the same topic, just a question about how the cameras are installed. Unlike other traffic cameras you see in the city, these units are sitting on the ground, where a passerby with a can of spray paint in their pocket could easily render them inoperable. The city has already had one of the units stolen. Are you concerned about having the cameras so easily accessible that make them targets?
Well, the technology is what it is, and we had a competitive bid to select the vendor that sold us the cameras, and the one that won the bid happened to be a camera that was located on the ground. You could say in some respects that provides some benefits in that you can maintain those cameras without climbing up a ladder or up a pole. But on the other hand, you have this 800-pound camera that is subject to being defaced by people who choose to do that sort of thing, which is a tiny little minority of people who do that, not just to cameras. And the one thing that seemed odder to me is that one could be stolen when it weighs that much. But we will be making sure that these cameras are secure. We'll be making sure that we keep an eye on them to make sure that they're not defaced. But in the end, I think what they are is a very valuable tool to promote public safety, to save lives, and to save injuries, especially for some of the most vulnerable people like pedestrians and cyclists.
Okay, thank you. We go next to Jennifer Pagliaro from the Toronto Star. Jennifer?
Hi, everyone. I wanted to start by asking Mayor Tory just about the announcement that the Premier made about transit-oriented development. Seeing as that's likely going to impact Toronto more than anyone else, I'm wondering if you were briefed at all on that situation, and to your understanding, whether that conflicts at all with some of the policies and plans the city had for itself.
Well, first of all, if you go back to the time of the agreement we entered into with the province that concerned the $30 billion worth of transit they're going to largely pay for in the city of Toronto, that was a part of the deal that there would be policies brought forward with respect to transit-oriented development to facilitate that and to make it happen in as expeditious but careful a way as possible. And in that agreement, it was indicated that there would be extensive consultation with the city on all of these projects, and that the legislative measures that were announced today would only be a backstop. The answer to your question is I was briefed yesterday by the ministers with respect to the precise contents of the bill. I had a conversation with the Premier last night, and I can only say that their commitment, their absolute commitment to working with the city, to continuing to collaborate with the city, to being respectful of the city's planning regimes and our plans for development and for communities and for affordable housing is very firm, and that if the kind of collaboration we've seen during COVID-19 is any indication, I will assume there will be a good faith in carrying out that consultation and in trying to abide by the policies we have in place to oversee development in the city.
Okay, thank you, Mayor. I had a separate question on a different topic for Janie, if she's still there. Just wondering if there is an update. I know earlier on Camp TO, the city had said that that program had yet to be fully subscribed. I'm just wondering if there are program spaces remaining and how the program is going to date.
Sure. Hi, Jennifer. I actually had an update on that just before this call. The program is currently prescribed at about 70%. 70% full through the summer. It's staggered throughout the weeks. Some weeks are more full than others. There have been some locations where there has been little interest and they've been canceled, but those are few and far between. So we've adjusted sort of the registration and the program delivery based on what the interest is, which is a usual sort of course of action for us. So we're encouraged right now. There's many that are registered, and we continue to register, for the next several weeks as the program plays itself out.
Thank you, Janie. Final question is to Catherine Aylesworth from Global News. Catherine, go ahead, please.
Hi there, this is both for Mayor Tory and Dr. de Villa. So the Blue Jays have returned to train and the NHL has chosen Toronto as a hub city. Is there any concern about having multiple professional sports teams from various states and other areas of Canada coming in and out of Toronto?
So I'll start off with an answer to that question. You know, having had the opportunity to observe and really study and review the protocols that were put forward by both the baseball and the hockey professional leagues, the key concept there is that they maintain themselves in a bubble, not dissimilar from what has been promoted for individual families and households. That if you stay within the context of a bubble, that the risk to the public is actually very low, if anything at all. So that's the major concept. They're interested in ensuring the best health of their players, certainly, and there are procedures and practices that they have, those two respective leagues have, to protect their players and all the ancillary staff that are there to support them. But from a public health perspective, as long as bubbles are maintained, one for hockey and one for the baseball players, then the risk to the public is minimal, if anything.
May I just clarify that the arrangements made, for example, with baseball, as has been chronicled very accurately in the media, are arrangements that pertain to the training. The spring training, it's not spring anymore, but to the summer training they're going to be doing. And there is one bubble there that consists of both the hotel and the Rogers Centre, because they're all one in the same building. And then with respect to the hockey, and so the issue that involves teams coming and going, the visiting teams as it were, is in the midst of being discussed now and has not yet been finalized. With respect to the hockey, it's a different proposed arrangement whereby the teams would come to Toronto and stay, and thereby could be included in one bubble that would have them all, again, with respect to both hoteling and also playing the games at the Scotiabank Arena, staying in the same bubble. So these are things that have been painstakingly worked out. I've been incredibly impressed at the detail on all sides that has been exercised, and at the great cooperation between the Major League Sports and the governments, plural, federal, provincial, and municipal, including public health. And nothing will be done that is going to compromise public health, and we're relying very much on the advice and concurrence of our experts before we go along with whatever is being proposed.
Okay, no follow-up. Thanks so much.
Brad, can I also just mention, I mentioned 85 complaints over the weekend. That was 85 complaints actually that came from parks and gatherings on Sunday, yesterday. So there may have been a similar number. I just don't have it in front of me for Saturday, but it's still a remarkably low number relative to what we were seeing earlier a couple of months ago.
Okay, thank you, Mr. Mayor. That concludes today's briefing. The next briefing is this Wednesday, July 8th. Please note the time change to 4:15 p.m. We'll talk to you then. Thank you.